My name is Jackie Waldberger with Belmont Village Senior Living. And Belmont Village Senior Living is a very unique place to live in that we have some of the most interesting and intelligent people that retire at our communities. It's a great responsibility to keep everybody safe, of course, first and foremost, and obviously engaged with hospitality. But additionally, we provide lifelong learning opportunities for our residents, for our staff, our family members, and for you, the public. It has been our mission for the last 20 years to be affiliated with strong academic partnerships like UCLA, for example. Today, we are bringing you the founder, director, and professor of the UCLA Center for Integrative and East-West Medicine. Dr. Huey is an internationally acclaimed educator and researcher. He is board certified in internal medicine and clinical pharmacology with an expertise in geriatrics. Since the 1990s, Dr. Huey has served as an advisor to the World Health Organization for the standard terminology in traditional Chinese medicine, appropriate integration of traditional and complementary medicine into health systems and healthcare services, and also for the quality of academic education in traditional medicine. We will be started shortly. Dr. Huey is going to be taking questions at the end of the webinar. Please use the Q&A feature and your questions will be answered as much as we have time for. Please don't ask any personal questions. Obviously, he will not be able to give you personal medical advice, but general questions are welcome. And without any further ado, ladies and gentlemen, I present to you Dr. Huey. Dr. Huey, thanks for being here.
Good morning. Thank you very much, Jackie, for your kind introduction. And thank you for the opportunity for us at UCLA to share what we have learned in our laboratory and our clinics to help our community to stay healthy, particularly all of you at Belmont Village Senior Living. So what I want to do is to start, asking some question, whether any of you have neck spasm, tension, or pain. So this must be a common clinical problem. At least this is a problem that we actually see. I would say almost 80% of our patients will get referred to us. But it's not just the pain, it's not just the migraine headaches, the shoulder pain, the numbness, but then many of the ENT problems, eye problems, dental oral health problems, and sinus problems, and people's anxiety and insomnia, basically restless sleep. So I think the key thing really is to recognize that our posture is very important. Our ability to handle stress is very important. And we'll talk about not just psychosocial stress, but just being on the Zoom call this morning, obviously would make many of your neck to be tight. And that may sometimes explain why you feel nauseous, feel dizzy, and but some people with no sort of pain doesn't mean that the neck is not tight. What I really want to show is that there are many, many reasons why our neck is tight. Next slide. So obviously, having cold wind blow at your neck, the way you sit facing the computer, reading your book, because oftentimes when your head is upright, it only needs 12, the kind of pressure on the neck muscles is only 12 pounds. But when you bend your neck down, it could be from 40 to 60 some pounds on those poor neck and shoulder muscles. So very, very, very important to make sure that your neck is sort of flexible. And obviously, many patients, we kind of ask what happened at home. Sometimes they've been very upset. When they're upset, the neck gets very, very tired. And one thing that I advise our patients is to have your sort of exercise that is more focused on flexibility, focus on stretching. Try to avoid loading exercises like push-ups or weights. Some weights is fine, but oftentimes to the point where all your muscles in the body get tense up. Even driving long distance with like a mini whiplash, you know, on 405, 101, and 10. And many patients may actually have a minor motor vehicle accident, but it's nothing minor about it because after the accident, the neck, you know, spasm already occurred. And you can feel your knots in your neck. So, because the next slide, the most important thing that we try to let people know that pain is only one of the manifestations and complications of a tight neck, because the neck obviously connects, you know, the brain to the rest of the body, and there is control systems in the neck, our blood pressure, our heart rate. There's the endocrine glands there with the thyroid. Many people with thyroid problems, nodules, Hashimoto's, thyroiditis, many of their neck is also very tight. And lymph nodes too. So besides the usual orthopedic, you know, type of problem that people would present, there's also many of the non-pain manifestations. Most importantly, what we want to focus on is that the vagal nerve really is the nerve that helps slow things down. It's more restorative type of function. And it also controls inflammation. Remember, inflammation is central to 80% of the chronic conditions. And we have to basically make sure that our neck is sort of flexible and a full range of motion. And when you drive, you know, you can turn your neck, you know, rather than moving your whole body. So that's really the practical aspect of it that I want you all learn today. And I start this first because I want you to learn this during the rest of this presentation while I talk about the concepts behind how we apply some of these approaches to help our patients that wait for months to get in. Next slide. So first thing I want you to learn is crisscross your fingers, and then you layer your palm on the back of your head and using your thumb to kind of push against the occiput, and then you try to slide your finger down and move around the various areas in your neck. Now you will find some knots. I'm pretty sure most of you who may not have neck pain, headache, sinus problems, and ENT problems, TMJ, clenching teeth, your neck is very tight. Okay, those knots needs to go away. So by kind of massaging it, you make it go away, right? Because I don't want to get into all these acupuncture points, but I will show you some of these acupuncture points because next slide. The point right there is very, very useful in alleviate a lot of the head-related problems. It helps patients with eye, help patients with fatigue, and when you get a cold, the cold air hit your neck, and that's how people get their sore throat, their runny nose, their cough, and their headache. So I, in general, suggest people to wear a scarf and protect your neck, because the cold air can zip through and just, I've seen people actually get their Bell's palsy, okay? And in, Asian countries, people massage this area to prevent stroke, okay? Next slide. Another area that I have always taught the patients to learn how to massage is from the elbow crease, 3 fingers base from it. You massage that area, you will find out that it's a little sensitive. It's a good hurt. If you open and close your fist, that muscle will stick out. This is an area that we really want you to sort of learn how to massage, this when people come and talk to you and you kind of feel bored. It's not just for the local problem, but it's also very useful for the neck, the elbow, the shoulder. So try to learn how to use this point for massage. I always tell patients that if people talk to you, you feel bored, you massage this point. Now, the next point I want to teach you is that if you are under stress and you have a stress type of conversation and you cannot get out, you want to learn how to massage, I would say the whole length of that bone where the thumb is, and push the muscle against the bone. If you are not under stress, that muscle is very smooth. If you're under some stress, it feels a little sensitive and it feels a little bit nodular. Now, if you're pregnant, please do not massage this point because it can induce labor, and we actually have used it, in the delivery room. So this is a point that has been studied that it increased pain threshold. It also modulates the stress response. And it's very, very useful. One point that if you have stress and you cannot get out, you just massage it to negate the negative effects of stress on you. Okay, so now I just want to go and talk about, my how this get incorporated into our overall type of approach to helping patients at UCLA. So a little background, I have been at UCLA since the late 1960s. As a chemistry major, I graduated and with a Regents Scholarship to attend UCLA Med School, and I've never left. I get trained in internal medicine. I subspecialize in clinical pharmacology, and also get expertise in geriatrics with a new idea with a dream actually, that I want to build a new model by blending the best of what I can learn through UCLA modern biomedicine, but also to try to actually learn what China has been practicing in terms of Chinese medicine, but also since 1955, they have been embarking on blending Chinese and Western medicine to create a new medicine. And so I've learned from what they have been doing the last 60 years through my studies, and then applying what we can learn to make it work at a place like UCLA since I started the center in December 1993. So without the tutelage of my mentors, and I will go over my mentors. First is Dean Malenkov. Next slide. And he, obviously, for some of you who may know him, because he was the one that's from 1962 to 85 when he retired, he built UCLA from a new sort of medical school to become a world-renowned institution. And I basically get a lot of inspiration from many of my chats with him at the bedside and also at his home. Next slide. Another one major mentor is our chairman of medicine, who just stepped down at age 80 as chairman of medicine. He is also inspired by Dean Malenkov. He's been at UCLA 60 years. I've been at UCLA 52, 3 years. So obviously, without his support, and who allowed me to build the center when he became chairman in 1993, we would not have been able to grow to what we have become now. Another mentor that I've learned is Mr. Gerald Oppenheimer. He obviously has been the living example of what he has learned from many of the center's conferences, including daily use of TENS unit to stimulate the vagal nervous activity in his neck to calm down inflammation. We lost him in May, close to age 1999. So we've been very lucky. For many years, I've learned from so many mentors as part of my growth at UCLA. So next slide. So our center, when I first established the center, what I decided to do is not to focus on one modality like herbal medicine or acupuncture or Tai Chi or one disease. What I hope is to create a better healthcare model, hopefully a better healthcare delivery system to try to provide healthcare that is safe, effective, affordable, and accessible for people, families, and communities. I think I already get the model down. Right now, I've been working on scaling it. Next slide. So today, I can only say a few words about our clinical model, but obviously, I've been advising, different cities and countries, and also the World Health Organization about why this is important for using this to address the healthcare crises that we are facing. Next slide. So clinically, when I started in 1993, it's only a one-man band, and you already see the team that I have built over the last 20-some years through training medical students, and then the residents, and then the fellows, and then keep them as faculty. So we basically have built this clinical laboratory to demonstrate how this model can help people beyond the very best of what UCLA can offer. And what we really want now is to make this to be made available to people as early as possible so that they don't come to us as the last resort. Next slide. So we have the Santa Monica Clinic, which is really the main hub. We also have a site in Westwood to take care of patients that are going in and out of hospitals. We have a program in the hospital in Santa Monica, and then we have clinics in the Torrance and also in Westlake. Next slide. So just give you an example of a patient, that come to see us. Many of them have chronic pain because most people equate Chinese medicine with acupuncture and acupuncture for pain control. But realistically, we have a model that addresses the person with many of these conditions. Because if you think about trying to find breakthroughs for any one of these diseases, it would not be as good as using a person-centered model. This is what we have developed. And we go back to Sir William Osler. Next slide. So William Osler is the father of modern medicine. And he basically was at Johns Hopkins. And my dean, Malenkov, actually was chief resident at Johns Hopkins. And he came to UCLA to help build UCLA to where UCLA is now. And he talked about the study of medicine begins with the patient, continues with the patient, and ends with the patient. It's much more important to know what sort of a patient has a disease than what sort of a disease a patient has. Because if you have many, many diseases and they see different doctors to take care of different parts, it will not be an optimal way. So next slide. So after like learning about sort of both East and West for good, I would say 30, 40 years, I wrote this paper with a sociologist and a medical anthropologist about this patient-centered medicine, person-centered medicine at the intersection of East and West. And it really emphasized that there's a difference between the West way of looking at the person and also the Eastern way. And what we try to do is to put the two together and create this unique model that we have created at UCLA. So it's not an assay, it's not a particular drug, it's a model. Next slide. And I am so glad that the New England Journal of Medicine, a paper published by Harvard Medical School, who wrote this paper to remind people that we need to put the patient back together. We need to know about social determinant of health. We need to learn the new idea about network medicine, but focus and emphasize the limits of reductionism, because most of the research now is trying to figure out from a molecule to a cell to a tissue to an organ and back to the person. So we have all our trainees read this paper. Next slide. So this is kind of our clinical model. Most of our patients are referred, and hopefully they come early with not so many problems or not on too many drugs and not having too many surgeries, which I think those are still needed, but hopefully they don't need 10 MRI scans. They did a lot of workup because there are certain areas that are blind spots of the very best of what we practice in Western medicine. And using a way of looking at the person as a whole by using sort of the questions that we ask patients about their lifestyle, about how they handle their stress. Some people say, I have no stress. But then when you talk to them about, I am a lawyer that deal with death penalty. Some people have kids in the hospital. That's not as stressful as someone with a gunpoint. So some people may not even know that they are under stress. Someone say, I have no stress, but then I work as a social worker at the county system. So understanding the person with stress, but also touching the patient. A lot of patients with pain, we do scans, but if we do not touch the patient, you would not find out that they have a lot of very sensitive areas in the body. We may call it trigger points. We may call it tender points with fibromyalgia. We also know that many of these are acupuncture points. So most importantly, after we have a really comprehensive assessment of the patient, we are lucky that when the patient gets sent to us, they already have been very adequately assessed by our colleagues. And so what we want to do is to try to educate them about ways to handle the stress, what they should eat that is appropriate to their constitution. And then we also would teach patients how to do acupressure. We recommend them to go learn how to do some simple Tai Chi or learn the 8 brocade Qigong. We teach them how to access the website at UCLA to learn about mindfulness meditation. And many of them also will want to do yoga or do Pilates. In general, they are very useful by more stretching, but I want them not to stretch too much because they may be harmed by it. And in the clinic, we usually able to modify their medications. We sometimes advise them not to take so many supplements that may not be necessary. In the clinic, we do acupuncture and we do trigger point injection. Now, people who do not like needles, they get scared of needles, we teach them how to use a TENS unit, how to use the golf ball, how to use a tennis ball. So the key thing is to teach them how to take care of themselves. Without the patient taking care of themselves, again, it will just be reactive type of treatment. Next slide. So our patients, we collaborate with our OT, PT department for people with many of the pain in the back and the knees and hip. I suggest aquatic PT because obviously you walk for daily activities, but I think that if you try to exercise, for your heart or whatever, your knees and your hip and your back cannot handle it. We also work with our behavioral services, and depending on the medical subspecialty problems, we collaborate with our rheumatologists, our pain specialists, our cardiologists and oncologists, and so on and so forth. So what we try to do is make sure that patient watch their posture. And I always, joke with my patient, if I see you walking in with your head down, looking at your phone, you have to write me a check for a nonprofit. Or picture yourself being, someone who have to, walk across the crosswalk very slowly with your head down. Okay, so next slide. Now, music is a very, very, very useful medicine as well. And we're just beginning to do research with it. The NIH is supporting research in this area. A lot of people are very lonely, I know, with the pandemic. We need to provide a support system, just teaming up with young people and talking to the seniors. And so pets are very important and useful. And obviously, one thing that I always emphasize particularly for a lot of patients who are women who come to our clinic, I think that crying is a very, very, men too, I think crying is a very useful defense mechanism when we are hurt. But a lot of people basically get into sort of trouble by swallowing the anger. So they anger in, they put on a smiley face, but inside they are burning. Burning meaning inflammation. And that's why many of them patients that I see, they come in with their lupus flare, their rheumatoid arthritis, their Graves' disease, and so on. So I think very important for us to learn ways to manage their stress. And it could be mechanical stress, it could be chemical stress, it can be climateric stress. It's not just psychosocial stress. When your body is deficient, when you have chronic problems, your body just cannot handle a little bit too much of what we take for granted. Next slide. So we recommend our patients to learn about Tai Chi, and there are many styles. We in general recommend a very simple 8 brocade Qi Gong. Qi is like the life force, the vitality. Gong meaning you work. You basically learn how to do deep breathing. You have meditation as you stretch. So that's the 8 brocade Qi Gong that we recommend to patients. And we show them to go to YouTube, and then they can follow some of the practices. And then we teach them how to eat. In general, East and West is to recommend an anti-inflammatory diet. Next slide. And in general, Western nutrition give you general ideas. Chinese medicine actually fine-tuned to the individual, to the, like for women during different parts of the month, and also for sure to the season. and to every 2 weeks. So in general, a good, well-balanced diet would be important, and we have conferences to emphasize this approach as well. Next slide. So in acupuncture, as I said before, we don't do it just for pain. We actually do it for stress. And when you deal with stress, you can help many of the conditions that is listed here. There are different levels of evidence from research to support some of these approaches. But I would say that acupuncture, if you use massage with your hand, with tennis ball and golf ball, and also to have sort of the TENS unit, TENS, trans electrical nerve stimulator, we are able to teach our patients to take it themselves before they can come back to see us every 2 to 3 weeks, because we are so back up. So we teach our patients to use a golf ball to massage the bottom of their feet and both sides of their thigh. We also have teach them to use not one tennis ball as shown here. We teach them to put 2 tennis balls into a pair of stockings or pantyhose, and you roll up and down your spine, but also to knit the sore muscles in the low back and also the buttocks. Now, this is like the pads for the TENS unit, which we teach the patient where to put it so that they can give themselves acupuncture-like stimulation at home every day, up to 1 to 2 hours a day, not the 15 minutes as recommended, because I think that a lot of people with many different areas that need to be stimulated. Some of the patients would, including myself, have a massage chair, which now can massage your neck and the shoulder, your back, your butt, your feet, and I've been doing it since 1994, so it got 27 years. So next slide. So there's other approach that we use. It's a Western approach. It's called the trigger point. There's an overlap between acupuncture points and trigger points, and one of the very common point is in the shoulder, the trapezius muscle, okay? And it's really at the top of your shoulder, and they're usually very tight. And when that's tight, it really gives you a lot of the symptoms, not just in the neck and shoulder, but many other areas as well. Another very common point would be the muscle overlying the bottom part of your wing, the scapula. That is an area that it's a good hurt when you massage it. And usually when you are stressed, that area gets very sensitive. It also makes your neck and shoulder very tight. And also your gut, for people with IBS, that area will be very sensitive as well. I mean, there are also points in the front of the body as well. But I think by using the tennis ball to roll up and down of the spine, you will be able to find some of these sore areas that may relate to just a simple soft tissue pain, but it also can relate to internal problems. Next slide. So many people who have headaches, eye problems, ear problems, jaw problems are related to many of these tight muscles. So instead of like doing many of the procedures at the organ, you take care of the person by teaching them about the posture, dealing with the stress, by inactivating those knots in the neck and shoulder, the back as well, right? And your pelvic area and your thigh muscles, the IT band, very tight. Sometimes it's a stress organ. It may precipitate some people's sciatica that may not have very bad like lumbar, structures in their MRI. Next slide. So many of these like trigger point, tender points, which overlap with the acupuncture point, this is where East meets West. It could be due to chronic microtrauma. It could be due to a macro trauma. It could be due to sleep disturbance. When people don't sleep well, their neck gets very tight. There's a point in the neck, it's called good sleep. So if you do not sleep well, that point is very tight, sensitive. So many of the psychosocial stress and any diseases would make these muscles tight. By the time you have many of the diseases, you have many of the tender points. Next slide. So we can never build enough clinics to help the millions of people out there. I think that each patient that we are able to help, there are many more people who are suffering. So, and then there are different types of research. I've gone from, bench research, as a clinical pharmacologist, I developed drugs and so on. But I think that education, our research is synthesizing what we have learned, that I think it's safe, that I think it's affordable, it's accessible and effective, and then share it with not just the healthcare professionals and providers, but also the government in terms of their policy. We also will try to help businesses to learn how to increase wellness of their workforce so that they will be able to sort of have a more productive workforce and also cut down the business expense for medical care. And obviously, we would like to educate the public, particularly the community that are underserved, because obviously they have trouble assessing, our type of facilities, and we want to bring some of these safe, effective, cost-effective, affordable, accessible approaches through our educational programs. Next slide. And at UCLA, besides training people in medicine, I have taken sort of our model and make it available to all the undergraduates, have a GE, 5 GE course. And because I want people from different disciplines to basically recognize that there's a paradigm shift. The current medical model is so successful that we are able to help people live. So now people can live to the right, young age of 80s and 90s. So you need a whole new type of model to allow people to age successfully and gracefully. And so to try to address the healthcare crises, which I'm most concerned about, is that we need visionary at every sector to come together to try to put together the programs, train enough people for the needs of the new world. Next slide. So I have a long journey at UCLA. I spent the first 20-some years to figure out what I can do to put the two medicines together. And I emerged by 1992 to talk about this model at the international conference in San Francisco. And then in 1997, I already warned about the looming healthcare crisis and alluded to the integrated medicine's potential. And I advised the WHO since 1990s. And all the way to 2019, when there is a WHO workshop on the appropriate integration of traditional and complementary medicines into health systems and healthcare practices. Next slide. And we just need to sort of think about bringing trust, respect, compassion back into all our relationships. We need to support low-tech, low-cost prevention and early disease recognition. We try to work in teams with all type of healthcare professionals through interdisciplinary type of educational programs. And obviously, we need to optimize our environment. And that's one of the topics that I will be speaking, about sort of the role of integrative health for climate change, effect on health. Because the model can be helpful from the person to families, to communities, and to the planet as well. Next slide. So this is my suggestions for my young students. I just gave a talk to some PhD graduates in Europe, in a major university in Europe. And I emphasized the importance of spiritual health. And I always emphasize that having the right spirit, and our spirit would live forever. And having meaningful lives, not just in quantity, but also in qualitative terms. It's not easy to strive for mental tranquility. But I think as long as we always feel grateful that what we have, and things could have been worse, but we are grateful that we have what we have, and then try to build harmonious social relations and alive in moderation, appropriate exercise. I talk about that. A lot of people have the exercise become their stressor that lead them to come to see us. Having the appropriate amount of time for rest, not just work so hard and then you try to crash, you will never regain your reserve. Eating the right diet. In general, eating less. And I know a lot of people go through intermittent fasting. My general idea is to eat 70, 80% full would be fine. Less, it will be even better as we get older, depending on the person too. And having a healthy lifestyle will allow us to build the reserve that would minimize cognitive, mental, and physiological decline. And obviously avoid injury. I'm not talking about big falls. I mean, that's why Tai Chi is very, very useful to prevent falls. But any type of injury, I have a patient who come in with so much neck pain and hip pain and shoulder pain, trouble even lying down. And one of the things besides the treatment that I found out is that she was, working in the garden. And obviously, when I stop her from going to the garden, which is important for her, I say, you go back when you are better, but get very, very sharp equipment. Because sometimes, when people try to cut the tricks, the sort of pain from the muscle spasm would come on. So that's the reason why we have to be a detective to try to understand what happened. Not just order another test and write another script. Is to try to understand what happened when things, doesn't, look well, and what they are doing, good as well when they are doing well. So I think the key thing is to know the person with the problem. And immunization, I agree. We all should get appropriate immunization, including, COVID-19. Next slide. So if you would like to know more about our work, you can, join our newsletter, and then you can scan, the QR code. And I will use the remaining time to answer any questions that has been posted. Thank you so much for listening.
Thank you so much, Dr. Huey. We do have many questions, and we'll try to get to as many of them as possible, but I certainly want to tell you that I'm sitting up straight. I am trying to make sure my posture is straight, and I've been using some of your pressure points, so I already feel relaxed. And some of the comments in the chat from a couple of folks is that they started using the pressure points that you suggested while on this webinar, and they're already feeling much better. So thank you. So I have several questions. The first one I'd like to present to you is, and you alluded to this earlier, about Chinese exercise like Qigong and Tai Chi. But the specific question is, how does it help the elderly? And does it help the elderly with better mobility?
Well, this is a very good question, Stephanie. Tai Chi has been used for health maintenance, but since 1996, publications at the American Journal of Geriatric Society already compared Tai Chi with many of the other exercises, and it demonstrates that it's the best exercise, particularly to prevent falls. And the Arthritis Foundation has already recommended Tai Chi for all their clients. So there's a lot of benefits of Tai Chi for pain, fibromyalgia, knee arthritis. There's been research done at UCLA by Dr. Laresky in psychiatry that it helps people respond to the drugs with depression. Dr. Michael Irwin in psychoneuroimmunology have demonstrated that Tai Chi, a modified simple form of Tai Chi, actually enhance immunity after you get the shingles type of vaccine. Mm-hmm. And we have demonstrated Tai Chi can be very helpful for tension headaches. And so the key thing that we will try to work on is to, well, where do you find certified Tai Chi instructors who not just teach Tai Chi for health maintenance, but to teach Tai Chi for specific conditions. We believe that there's a need to train health coaches who would learn some of the things I talk about, but they may specializing in Tai Chi as part of the health maintenance. Right now, there's no one paying for it. Insurance is not paying for it, but there is a health insurance that actually covers acupuncture and also Tai Chi. So if your organization would pay for Tai Chi classes, it would be very helpful for your clients. But you want to find the right, instructors.
Right, I would imagine. Well, thank you. So another question is there any metrics to assessing the clinical outcomes of patients utilizing East-West medicine?
Actually, in general, there has been research done at the RAND Corporation to demonstrate the cost effectiveness of many of these approaches. Obviously not enough, because again, we actually have been collecting data, particularly with patients who come to us, and we have different groups of patients who come to us, people with Medicare, people with PPO, but also people who have HMO, and that we have looked at data remain unpublished, for low back pain of different type, from the very severe. It shows some cost benefits. And so yeah, we now have the EPIC. We have data that we can now track with our clinic. We just need to raise the money to do this type of research. Right now, we are drowned by the demand for people who need to come to us. We don't even have enough time for our faculty to do teaching. So I am supported, by the endowed chair. And so I have some time to, but all my doctors are working, so hard in the clinic just to meet the demand. And we have several months of wait.
Oh my gosh. Well, that's unbelievable. And that brings me to a very appropriate question and a good segue. Someone is asking, what is the reason for the roughly 400% increase over the past 10 years in patients visiting your center?
Well, when I first started, I said I'm a one-man band, and then Jerry Oppenheimer started to support my fellowship in 1999. So I was able to kind of clone a little bit, including my own son. Okay, my son is born at UCLA undergrad biochemistry, medicine, internal medicine, geriatrics, and integrative medicine. He now runs the clinic program for our center, overseeing particularly the clinic in Santa Monica. So we now have like 15 clinicians. We basically almost like a division, a department within UCLA.
Right. It's unbelievable that the increase, and something's absolutely to be said about that. Well, we've got so many other questions. I'll try to get to them as quickly as possible. We still have a few more minutes. One of the other questions is, how can you speak about how dry needling and acupuncture can help with joint pain?
Well, I would say that now, if the joint is like bone against bone, if it's like very inflamed, you may need sort of the rheumatologist or the orthopedic surgeon. But I would say that a lot of joint pains, muscle and fascia and tendon pain around the joint. And there are research to show that acupuncture or even massage was able to help people with joint pain. So dry needling is a form of local acupuncture point, but oftentimes you can treat sort of remotely with other points because the body's linked through the fascias, which is a new area of scientific investigation.
Really? Good, thank you. Appreciate that. Okay, what are your thoughts on how to bring a person-centered integrative model of medicine to those who live in senior living environments, especially those with Alzheimer's?
Well, I had launched a nurse practitioner fellowship program besides the MD fellowship program with the support of the Baum Foundation from New York. And I think that it probably would be useful for senior living centers to have their like sort of a health care providers to learn something about what we teach at UCLA, because we have courses for undergraduate, courses for medical students,
right,
and rotations, and also fellows. So we are developing an online curriculum to try to make this available to train people throughout the country, is not the world. But the key thing is to have both the online and also offline at our clinical site to demonstrate how this is done. So we're looking for educational type of like telemedicine and also virtual reality to allow this teaching to be done so that we can reach beyond the confines of UCLA. So the last 2 years with the COVID-19, we are able to use the Zoom to teach people who are in different parts of the world.
That's wonderful. I know Zoom is a curse, but it's a blessing at the same time, for sure. All right, a few more questions. Let's see. Do you think brain waves can help stimulate certain parts of the brain to heal based off the frequencies your brain can pick up on?
Well, I think that's why medicine has become like moving from pharmaceuticals to electroceuticals. So that's why I think energy would become a very important approach to restore the imbalance in the body. So that's why music, sound, therapy, laser, so like some acupuncture points can be stimulated using energy rather than the needle. So that's why we use a TENS unit. But
right.
There are many different ways of, people have used a tuning fork over the acupoint to stimulate, the acupoint to send messages. My idea about acupuncture point is not for needle to puncture. It's more or less the body will tell you when you're not well, that area will become a little tight, a little sensitive, and you can use different ways for that area to be sort of stimulated to restore the body's balance.
Great, thank you, thank you. Just, I think we have time for maybe one or two more questions, but this one is regarding acupuncture points are related to an internal organ, but by stimulating the points, are we affecting the organ or vice versa?
That's a very good question. As I alluded to, is that in general, problems start probably in our muscles, our skin, and our fascia. But if you don't take care of it, it will go deeper and deeper into our bone, our nerve, and our internal organs. So what I have seen is that a lot of patients that come to us at the early phase of their bodily, mind, spirit decline, then they already have all these knots in their body. And that if you don't take care of it, it will become from what we call, well, you have a non-specific low back pain. The MRI is not bad. Well, you will get into very bad spinal stenosis and also problem with reticulopathy and disc herniation and stuff like that. So in general, if you already have organ problems, you already would have many of these points.
Sure.
But if you have all these points are sensitive and you do not basically find anything that's good, that means that you need to get rid of it and then you prevent it from coming on. I think this is a very good question.
Yeah, very good. Well, one more quick question and then I'm going to turn it over to Jackie. But this is a quick one. What is the name of the acupuncture tool you mentioned that stimulates a particular point?
Oh, TENS, right? TENS unit, TENS, electrical nerve stimulator. It used to be very expensive. Like when I introduced this 15 years ago, it was $300. Right now you can get on Amazon $15 to $30, $40, okay, with the wires. So now we can teach our patient how to take care of themselves at home.
That's right. I have one. I have one at home. So, and I did get it on Amazon. Thank you. Well, Dr. Huey, thank you so much. I'm going to turn it over to Jackie, but that is all the time, everyone, we have for questions. And I will turn it over to Jackie and then we'll be back to you in just a moment. Jackie.
Dr. Huey, thank you so much for sharing your knowledge with the general public. I can't tell you how many comments there were throughout this entire presentation of people who are just so thankful. It's very important work that you're doing, and we are just so privileged to have you on today. I did want to share something that you brought up that kind of caught my attention, was that for our families and for our residents from Belmont Village, I know that at our community here at Berkeley, we do offer meditation, we offer Tai Chi, we offer 2 different kinds of yoga. So we bring in professionals to teach our residents. We actually have residents that have been practicing for a long time, and so they enjoy having the professionals teach them. Obviously, we also have beginners so that it's engaging for all. So for our families and residents that may be watching at different locations, Belmont Village has very strong programming. We've got great funding for our programming. So please speak to your activities program director about starting those programs at your community too. And again, thank you all so much for attending. It was really an honor to have you on, Dr. Huey. Thank you, Angela. And thank you to my Belmont Village team members too. Stephanie, do you want to give them Susan Berger's information, our family advisor?
Yes. Thank you, Jackie. So everyone, thank you again so much for jumping on. We appreciate your attendance. And to learn more about Belmont Village, please call our family ambassador, Susan Berger, at 424-232-0701. And she'll be happy to answer any questions you might have. For now, thank you, everyone, and bye-bye.
Thank you.
Thank you.
Yeah,
Thank you. Be well. Thank you.
Enjoyed the
Bye,
session.
everyone.
Give me the chance
Thank
to help others. Thank you.
Oh,
Thank you.
yes, and you did exactly just that. So also, Dr. Huey, we will be sending you the recording, but this recording will be available for those people that didn't see it and for those that you may want to share it with too.
Okay, thank you. Bye-bye.
Okay, thank you. Bye.
Bye, everyone.